going to talk about today?
I think we'll talk about a little bit of problems people are having at this time, and what are the main source for these. So, little bit immune problems, people who are getting sick, and little we'll touch on the winter allergies.
Winter allergies. I think I told you during the break that I've got that.
Right.
My wife does too. I mean, we're both sneezing, and I don't know if it's because everything's locked up or.
Yeah, I think when you think of allergy, people think allergy is when the seasons are warm and good, like when there's trees and grasses and everything and leaves, and that is true. That is there. But what people forget and what happens is that there's ton of allergens, what we call indoor or in the house or in the car. In the winter, you're locked in. You're locked in here in the studio, you're locked in your home, you're locked in the transportation.
Right.
And all these places, if you think about it, there's heating going on. Okay. And with the heat, you have to blow the particles away. So what happens in the home, all these ducts are there. They're a reservoir of everything going around in the house. So they have there, and then they start to blow. And once they start to blow, it's like a summer breeze, if you will. Instead of pollens flying, now you have all the molds which is inside the house, all the dust and animal dander which flies. And ton of people have pets. And pet allergy is very, very common. Very often, once, twice a week, somebody is shedding tears in my office because they're allergic to their pets. And it's very common. So I think what happens, people don't think about it, but that is the fact. That what happens when you have winter and you're locked in, the indoor allergens from your household, they soar. And when they soar and they get aerosolized and floating around in the atmosphere, you breathe in, they land on your skin, and then you can have sinus problem, nose problem, you can have chest problem or skin problem.
I noticed Michelle, my wife, said, Pat, she goes, I cleaned the house, and she goes, it is so dusty.
Right.
That and when we go out in our sunroom, which is a 4-season sunroom, it never fails. After about 45 minutes out there, both of our eyes start watering, and sneezing, and runny nose, all that sort of stuff. So that must be the situation out there with dust.
Sure.
Yeah,
everything inside the house, right? And also in the cold, what happens is there's extreme temperature fluctuation too. You go outside house and then when you come inside house, the temperature drastically changes. And then the nose is the air conditioning unit for the body. It should regulate the temperature of the breathing air. So what happens is that many times that you have very cold and then comfortably warm, and the nose cannot adjust very well. So there's vasomotor imbalance, or the blood vessels of the nose, they can't regulate very well. So a lot of people have this vasomotor rhinitis or vasomotor imbalance, which adds on top of whatever else you may be allergic to.
Okay.
So winter could be quite severe for the nose, for the sinuses, from this perspective.
Well, that explains it. Because we thought we were coming down with colds, but they weren't. They cleared up.
Right. And that's a good differentiation. In the winter, if you don't have flu, which you will know because allergies usually won't give you fever and would give other problems with it. If you don't have flu and nobody else is having the same problems, and it is because of it, then maybe you have really some winter allergies which do exist.
Is there anything you could do for it? Is there any answer to that?
I think indoor management of when we see patients and we evaluate them and say them, well, okay, for instance, you're allergic to say mold, or you're allergic to cat or dog, or you're allergic to dust mites. We tell them what they can do inside the house. Okay, so dust mite precautions. You have to wrap your mattress in appropriate clothing with very tightly woven clothes, so the dust mites, which are the critters living in the mattress, they don't come up. Dust cleaning the house, draperies and everything, and cleaning duct is worthwhile. Because if you have every couple of years, you should take them out because there's really big reservoirs sitting in those.
Okay.
So I think you can do, and then if you have pets and stuff, you can have some air purifier or air filters, which you can get animal dander out. Okay, so I think those are the things, and really, if you think of allergies, the only thing you really can control really is your house. you cannot control anything outside the house.
Right.
And mold is a big source, especially in the weather here. People who have basements, and if the basements are musty or they have some moisture in it, that is a hub for the molds to grow.
Okay.
So I think that is very, very common, and I think drywalling and proofing, waterproofing the thing and keeping it hot.
Mm-hmm.
You know, the moisture is the number one friend for mold.
Mm-hmm.
So the dry you can keep, that is better. And I think, you know, actually it's very counterintuitive that people who have mold allergy, in the winter time it's so hot inside the house, people have humidifier,
Mm-hmm.
which put moisture in the home. Now that moisture is going to promote mold growth inside the house.
Really?
You're putting moisture in there.
Yeah.
Okay. So people do it. It's a common practice that, okay, well, you know, let's have humidifier.
Right.
If you're allergic to mold, you want dehumidifier, something to suck moisture out.
Take it out.
Yeah. So I think, you know, those are the things you can do, and you have to keep on top, because, you know, these happen and, you know, problem get, and then of course people get much more subclinical infection of flu in the winter time, which also affect nose and sinus area.
Mm-hmm.
So, you know, these swap hands with each other, and over time, you know, people have sick of one after other after other.
You know, about 2 weeks ago, I actually missed 3 days of work because, and I imagine you're familiar with this, of the stomach flu.
Mm-hmm.
Now, I had the shot for the chest flu, that
Right.
that flu, and I've had, knock on wood, I haven't had any problem with it. But man, I really got knocked out with this stomach flu, and
Right.
I was down and out probably 5 days before it really
Wow.
went away.
Sure.
Have you had any experience with that this winter?
No, you know, I don't deal with the GI issues.
Okay.
So, you know, they will go to the primary care doctor.
Okay.
So no, I don't get to see them. But
Alright.
yeah, you know, that is something totally different.
Okay. Yeah, it's pretty bad when
Yeah.
you get that. When
Sure.
you get that. You mentioned immune systems or
Yeah,
immunes.
right.
What about that?
Yeah, you know, that so people, you know, typically winters are harsh on people's health, and people get a bunch of antibiotics, bunch of infections, and it's, if you really get sick all the time, and if somebody has an infection and you catch it, or, you know, you bet that, you know, I'm going to catch everything going around the neighborhood, then that indicates that, you know, you may actually have some weakness of your immune system. Not uncommon at all. A lot of doctors don't think about that, let alone the patient.
Okay.
It used to be before that immune deficiencies are very, very rare. So somebody getting sick all the time, it's with common problems, people should think that common things are common. People, and including doctors, think rare conditions are the one which causes, which result because of immune deficiency. But if you're getting sinus infection, which you cannot boot it out by one course of antibiotic, and you get one course of antibiotic and boom, second round, couple of weeks later you get other one. You get recurrent ear infections even after having the tubes in. If you get bronchitis after bronchitis and pneumonias, if you run high fever, if you're feeling unwell, and if you have sweatiness and you can sleep well and you're losing weight, all this can come from immune deficiency or weakness,
Really?
which is not uncommon.
You mentioned the tubes in the ears.
Yeah.
I once was raising a little boy that had to have the tubes put in his ears because he was constantly sick.
Right.
What is that all about? I never did understand that.
Yeah, the tube is, you know, ears are connected to the nose, okay? And the tubes are supposed to, it's the draining system for the ear. So if your nose is not healthy, your sinus is not healthy, and space behind the nose, which is where the tube drains, is not healthy, then your drainage is not right. And if drainage is not right, then the bacteria grow in it.
Really?
Yeah, you know, you have a cup of this cup sitting here in the table.
Right.
Would you leave it here for 5 days and drink it?
No.
Why not?
It gets bacteria in it, I would think.
Why?
'Cause I don't know. I've seen some weird things with water.
This is exactly what even water, because anything which is stagnant like pond water.
Mm-hmm.
Okay, this is like a small pond or a reservoir which doesn't move. If something is static for a while, bugs are around us, they will harbor in it, and they'll have a party in it, and they will grow. Okay, so same thing, you think about the ear. If there's mucus made in the ear and it doesn't make its way out to the nose or behind the nose, then the bacteria is going to grow on it.
Really?
So the tubes with the ENT doctors put, and this tube is not working here. So what they put is they put a tube through the eardrum,
Right.
so it drains outside.
And
Because
it does come out.
Yeah, yeah. There's ventilation for it. Okay, but the lot of those patients tend to have allergies, because if allergies affect your nose and sinus and space behind the nose,
Right.
and there's a lot of mucus secretion and blockage from it, and sinuses get blocked and everything, then a lot of that can come from that too.
Okay.
And if tubes are placed in and the ENT doctors have fixed that one up with it, then you're still getting sick. Then it's not a problem with ventilation. It's the problem with your system is just beaten down and it's weak, and you may have a problem with that.
And this goes back 30 years ago when this all happened. But I had never heard. I had raised my son, and I had never heard of the tube thing. Until
It's been around for a long time.
Yeah.
It's been around for a long time. Yeah. But the point we're trying to make is that if you get the tubes but you still get sick, or you got one set of tube and then get second set of tube and then third set of the tubes and fourth set of tube and still getting ear infections, maybe problem is not with the ear, problem is with your immune system.
Mm-hmm.
Okay, and that is what we are trying to bring home here. This is a very specialized clinic I have opened here. This clinic I ran the biggest clinic for such diseases in the city of Cleveland. So I have a bunch of patients here, very common condition, recurrent sinus infections, recurrent ear infections, boils on the skin, recurrent bronchitis, pneumonia, meningitis, anything, you're sick all the time.
Mm-hmm.
Think beyond obvious that, okay, well, this is not one pneumonia, this is not one infection, because they're clustered together and you're getting them over. Maybe your blood is weak, maybe your immune system is weak, and all you do is come to the office. We'll do the simple test to figure it out. It's a blood test we can do right here from Ashtabula Clinic, and then we can get the results back. And they're different part of immune system. Some part take of bacteria, some takes of the viruses, some take care of the fungi. So we can fine tune all those different parts of your system and make you wholesome and healthy overall. So it's something very simple, and we do, if in cases with extreme weakness of immune system, there's actually medications available in form of infusion, which we can infuse through your vein every 3 to 4 weeks, and then your body can recuperate from them and continue to stay put. So I have a bunch of these patients from Ashtabula since I started 9 months back.
Has it been that long since you?
Yeah. It's going to be in April. It's going to be a year.
For a year.
It's almost 10 months now. Okay, yeah. So, but I have a handful of patients now from all over, from Jefferson, from here, that they're getting the infusion. So they come to office, we infuse, and they live very healthy, productive life.
I can't think of who was telling me this. A gal was telling me that she had some kind of medical problem, and the problem, I can't remember, it was not anything to sneeze at. It was a pretty bad problem, but she said it affected her immune system and left her susceptible to
exactly
getting pretty
bad. I mean, if you're not if your immune system is not up to the snuff, you will get hit with it and you'll take much longer to shake things off. And a lot of older people have it too, and unfortunately doctors don't think about it. You go to emergency room or primary care, they will fix you and then forget about it, come back and fix you again. People think these are very rare diseases, but as a group, there are 120 plus conditions in this.
Is that right?
Yeah, and as a collection, immune deficiency as common as 1 in 500 people. So when I give lecture and educate people, I always say that if you have to be practicing doctor, you need 500 patients at least. And if you have 500 patients, you have at least one patient with immune problem. Okay? And you just don't think about it.
Actually, I think you're the first doctor that I've had on the show that talked about immune problems.
Yeah, because there's nobody else does it here. And a lot of allergists. I'm allergy and immunologist. So a lot of allergists, know allergies, but they don't know immunology part of it.
Right.
Okay, and I'm very comfortable, and I worked at pretty big centers for these, so I'm very comfortable with both immunology. But immunology is very important, and it's very rewarding. Those patients are quite sick, and they need you, and as a matter of fact, I have a patient coming from Mentor today to get the infusion. I just put the order before I came here. So he's going to get infusion. And a lot of these, little kids who are getting sick, older people who are getting sick, in the youth people are getting drained down. It's not uncommon. It's really common to have it. 1 in 500 is the incidence. Very common.
I remember when I worked in the radio station before I came over here. Now this is kind of opened up, but when you're working a radio station, you're in a secluded room with no air, really. Just windows to look out, and like those windows there.
Right.
And I remember a doctor, I was interviewing a doctor in there, and he says, every time I come in here, you're sick. And I go, I know, I've always got a cold. And he goes, it's because
you got an immune problem.
He said that there was no ventilation. He goes, when you don't have ventilation, all those germs are stuck in here.
Right.
And you're talking into a microphone that other people are talking into. You're getting their germs off the mic. He goes, this is a walking germ hospital here. He goes, that's what you have.
That is true, but also that, if your immune system is good, you will be able to fend those things off.
Yes.
Okay?
Yes.
So that's true. I think what he said was correct, but that is not the only thing. If I put an immune compromised patient in the radio host, and a very immune potent patient in the radio host, the disease you will see in them will be very different.
Really?
Yeah, because so immune system, you're surrounded by the bacteria.
Right,
and the bug. And so ventilation is of course important, but normal person should be able to rise up to the occasion and do something better when push comes to shove. So people out there who really sick all the time through the winter, don't write it off. Allergies could be contributing to it. If you have recurrent need of antibiotics, sinusitis, and this immune problem may be contributing to it. And if that is the case, both of them are very easy to diagnose. We get, for allergies, you get answer before you leave the office. And for immune problem, within 2 or 3 weeks, we'll have the answer.
Really?
And we'll fix. My goal is nobody leaves this county around 25-mile radius all the way around. Nobody goes anywhere. We can fix each and everything right here.
So, if, like I came to you and said, Doc, I need to find out what I'm allergic to, is it mold and all, you could actually tell me that day?
Yep, I'll tell you not that day, I'll tell you that hour.
Really?
Yeah, I'll tell you that hour, and I don't do blood tests. Blood tests are not very accurate. I do tests on your body, and your body tells me what you're allergic to right then and there. And you actually feel it.
Do you put, say, a sample of mold on the skin or something?
Not this, yeah, and you can say that sample of mold, but what we have these solutions which have a small concentration of it, and you put it on the skin of the people, usually on their backs, sometimes on the arm, based on the condition people have, and then you can have a reaction and you can see it, and patient can feel it.
Really?
So if I put cat on your back, and that is bothering you, and you have a big lump developing there, then you see, oh, there's some problem there, because this is the minuscule, a billionth part of the cat causing the problem, let alone the whole animal. Oh, so we can tell you right then and there. It's quick and very informative.
Now, you find that you have these allergies. Is there medication that one can take?
Yeah, absolutely. There are all kind of medications. Antihistamines, there are anti-leukotrienes, there are nose sprays, there are inhalers, and allergy injections. Allergy injections, very, very potent. I have a pretty good clinic going on with that.
Yeah, there's a girl that comes on the show, the co-host here. She has to take, I think, shots twice a week or for her allergies.
When you build them up, you give them frequently. And after a period of 6 to 9 months, they get once a month eventually in 15 months time. Yeah, and they work very well.
Do you ever recommend getting rid of pets?
Number one.
Really?
If you have a problem, then get rid of the problem. Now, if you cannot get rid of the problem, then we'll work around it.
Yeah. Because a lot of people have a hard time getting rid of pets.
Yeah, I know. They'll get rid of their spouses or the kids. Before the pet.
Before the pet. That's true. Yeah. That is very true.
And you may be one of those, don't be.
I know. Gotta behave myself.
That's why I don't have any pet in my house. I don't want any competition.
Yeah, I had I remember one of the kids,
Right.
I was allergic to a cat. We had to get rid of it. And I loved this cat, but I had to get rid of it because always sick. He was always sick from it, you know. I was going to have you do a little bit of a...
Sure. Yeah. So I think, I'm very proud, and I think the clinic is going very well. I think it's a very good service, very useful service, and very, very hands-on.
Mm-hmm.
Patient come with allergy, asthma, skin problem, or recurrent bouts of infection. They can come to the office. I have very dedicated group of nurses work with me, and I have started clinic now in Jefferson. I'll be going three Tuesdays a month to Jefferson.
Okay.
To capture the patients from there because they're traveling far distance from there.
Mm-hmm.
So I've actually next week I start there. So patients can come. We can do the test if you have allergy to cats, dog, pollens, mold, food, fish, nuts, shellfish. A lot of those patients can outgrow. So if you have it, we will find out. We'll tell you within a visit. Usually with the same day. Sometimes patients are taking medication, we cannot do the test on the same day, then I bring him back in a week's time.
Okay.
Within 1 or 2 visits you will know. And then once you know, you can work on getting rid of those problems, so amount of medication could be reduced for you.
Let's take this call real quick, Doc.
Yeah.
Hi, you're on the air.
Hi, Pat.
Hi.
First of all, it's hard to hear your show, your guests. The commercials are super loud, but it's difficult to hear the guests.
Mm-hmm.
I wanted to ask a few questions. I'll give the questions, then I'll listen.
Okay.
I'm wondering if Medicare covers for the allergies testing. Does the doctor test for chemical allergies as well as traditional allergies by the skin testing? Can he tell by putting the drops or whatever he does on the skin? For treatment, is it done by shots or by drops? And I guess that's what I want to know.
Okay. We'll ask him. Okay.
Okay. Mm-hmm.
Thank you. Mm-hmm.
Great. Those were very good questions. Medicare does cover. Now, Medicare is as confusing as it gets based on the plan, but it does cover. I have several patients with Medicare who come. So testing is covered based on whatever, you plan or spend down or deductibles are. But it's a covered service for everybody. So that's not a problem. We can do. I see patients with Medicare each day. That is fine, and you can call Medicare to find out exactly what they cover. Second question was the chemical allergies. I actually saw a patient yesterday from a factory. Chemical allergy causes different kind of problem: eye problem, nose sinus problem, lung problem, or skin problem in a nutshell. So first I sit down with them to try to figure out what is the target organ for the person, and then there are tests to evaluate the result of those chemical on your body. So if your skin is affected, we can see it. If your sinus is affected, we can do CT scan, figure it out. If your lungs are affected, we can do breathing test and figure out the extent of damage from it. If a particular chemical, there is not a test, skin or blood for each and every chemical. So that becomes a little dicey in there. You can quantify the end result or end organ damage as opposed to saying or testing for that agent per se. And then based on, we always care for the patient. So your thing is, how can you limit the exposure to that chemical, and then you can be in touch with the people who work for to create the best situation for them. The third question she had is how the allergies are treated. The most potent treatment is by changing the first principle of allergy treatment is to avoid what you're allergic to. So if you're allergic to cat or dog or dust mite or mold, do the best you can do to take care of them. If somehow you're one of those people who who are very attached to the pets more than the spouses and so forth, then we can give injection, and once we give injection to you, your body over time becomes not being allergic to them. So that is a very fine treatment. It works 80% efficacy rate with that. It's very, very good and very potent. And patients come over time to the office, and after 6 to 9 months they're fine, and many times they're fine even within 3 or 4 months.
And you can keep the pet then?
Yeah, and you can keep the pet, yeah. So if you're allergic to cat and you can't get rid of the cat, then we'll have to give you injections including cat allergen and you'll be okay. The next question she had in there was the drops. There's a treatment called sublingual or under the tongue drops. That is not a covered service. So insurance don't pay for it. And if people, that's why I have not engaged in it even while I was downtown in big hospitals, because it is out of pocket and then patient has, so the treatment is available. However, effectiveness of that is not as good and as robust as allergy shot. So only place I think which is valid for those patients are the people who are very young. Like children, I hate to give shots to young kids. I actually am proud to say I don't have any kids on injections, and I can fix. So I think in some of those patients that is a supplemental treatment, but allergies injections are pretty reasonable, and I'm here now one evening till 8 o'clock Mondays.
Oh.
Okay, so I've made myself, for the first time in my whole professional career, I've made myself available in the evening so people don't have to miss school or work. They can come after work and get injections in the office.
Excellent.
So,
and you are located at ACMC?
ACMC, right in the ACMC in the outpatient building there. And on the, it is there. And I have a very good staff. I've trained them very well. And I think people will not be disappointed. It's a very good service.
If you call ACMC and ask for Dr. Chouksey, they will forward you to his office. I would imagine that's how that works.
Yeah, sure, absolutely.
And go and see him, because if you have any kind of allergies out there, there's no reason to suffer with.
Yeah, absolutely not.
And
absolutely
I think
not.
he's talking me into getting mine checked out. So I'd like to find out what's causing me
Yeah,
sneeze.
and people can outgrow things. Food allergies, people suffer twofold. One, they suffer because they don't know what they're allergic to. Second, they suffer thinking, very, very interesting it came about, penicillin allergy or food allergy, fish and peanut allergy.
Yeah, peanuts are big time now.
25% people can eat peanut down the road. Okay, so 1 in 4 people, once you're allergic to nut, it doesn't mean you cannot eat them for the rest of your life.
Oh.
Shrimp and fish allergy, 25% people can outgrow it. Penicillin allergy, I have a very big clinic of penicillin allergy. 90% of people after 10 to 15 years can outgrow penicillin allergy. Everybody, I bet every listener has somebody who's allergic to penicillin they know of. And I can tell you, you send those patients and we will take that allergy off their list. Very good skin test, very good blood test, and then I give penicillin to patient in office and prove it. I had a patient yesterday, 73-year-old guy, and we took it off the penicillin allergy.
Really?
So you don't have to suffer of ignorance, of not knowing something, or understanding, well, you can never outgrow. It is both ways. You can outgrow allergies, food and this thing. And bee sting allergy is another thing I'm treating here. If you're allergic to bee sting, don't be waiting an easy prey for them, getting stung and be done with it. Very good injections for that. So the clinic is good, and I think it brings and I call it womb to tomb service. Any age comes to the office. I see comfortably adults and children alike.
Very good. Get a hold of Dr. Chouksey at ACMC, and he can hook you up with some good health. And no sense, like I said, to put up with allergies if you don't have to.
Yeah, rashes, asthma, a lot of them is from allergy, and a lot of them get better.
Yeah, great.
They will be happy when they come to the clinic.
Good stuff.
Yeah.
Good stuff.